I'm Becca.
And I'm Danielle.
And we're going to fit and choose an ambulation aid for our 67-year-old patient with a femoral neck fracture. We have chosen a rolling walker for her. This will give her a little more stability when she's walking around because she has osteoporosis, and since she injured herself when she fell, we don't want her falling again. We're going to have her do a modified 3-point gait pattern. So what she'll do is roll the walker forward and step first with her left, since that's her affected extremity. That'll allow her to put more weight through her hands when she steps forward and has to weight bear. And modified 3-point means that she'll be doing weight bearing as tolerated while she's walking. So for her to walk, she'll roll left, right, roll forward, left, right, and then when she turns, we want her to turn to the right and take small steps so she's going away from her affected side. So it'll look something like this. And then she would complete her circle. To fit this to her properly, we want it to rest at about her wrist creases, so this is a little bit tall for me. To adjust this, I'm going to come down to these knobs. And it's actually easier to flip it over. And I would adjust it down like that. Okay. And the more important way to fit it is you want your patient to be at about 20 to 30 degrees of elbow flexion. So this is more appropriate for me to be using it. To fold the walker, you're going to press down on these tabs, and each side folds in individually, like that. And snaps back out. Okay, and I think that is it for how to use it. So Danielle is going to demonstrate sit to stand with me as the patient.
Alright, just starting with some safety tips on this wheelchair here. You're going to make sure that these brakes are on, so pressing down over here on both sides, on that right and left. And then also getting these foot plates out of the way. So you're just pulling up on here. There's this little, what am I trying to say? Bolts, excuse me. There's a little bolt right here, and then you just pull these off and lay them out to the side. Making sure you're using good body mechanics throughout this entire process. So really straightening out that back, thinning out that knee, and then off to the side. And Becca is going to be our patient here. And the first thing we want to do is get on that gait belt here, so we have a hold of our patient at all times, giving them a little bit more stability. So bringing this around here, and then taking it through the teeth side first. Tight but not uncomfortable on that patient. Making sure to get it a little tighter than you would think, because when they stand up, they'll loosen up a little bit. Folding it in that middle, tucking that extra in between so it doesn't get caught on anything. We're going to place their walker out in front of them, making sure it's close enough that they can grab with both arms. And here you're going to cue the patient. At all times you're going to have that grasp on that back of the gait belt, and you're going to be on their affected side, making sure if they fall, they'll usually fall to their affected side, so you're going to be guarding them on this side. Asking an aide to help if you need, and they will be on that other side. Grabbing behind that patient on that gait belt, and then keeping that left hand right in front of their shoulder, but not touching them. And then you're going to cue them, grabbing that wheelchair with both hands on those edges, and kind of scooting them to the end of the seat, and then you're going to press up with both arms, and then grabbing one arm at a time for that walker, just like that. Great job. And then again, cueing as Becca had showed, walking with that modified 3-point gait, so their affected side first, followed by that right side, just like that. Keeping a hold of that gait belt at all times, and then turning again to her affected side, or unaffected side, excuse me. And we're going to make it back. And you're going to come follow that on her affected side, excuse me, each time. Stepping back, little steps, just like that. back in the wheelchair, we're going to grab with one arm and then the other, and sitting back nice and slowly.